To tackle pressing issues in our nation, such as unequal maternal health care services, gender-inclusive agricultural support for small-scale women farmers, access to loans, and much more, the International Center for Investigative Reporting presents Spark 2.2, a 30-minute radio program aimed at igniting discussions on these challenges and preferring solutions to them. Spark 2.2 airs every weekday on different radio stations across Nigeria. Mondays, Federal Radio Corporation of Nigeria, 5 to 5:30 p.m. Tuesdays, Anambra Broadcasting Services, 4 to 4:30 p.m. Wednesdays, Freedom FM Kano and Jigawa, 4 to 4:30 p.m. Thursdays, Prestige FM Mina, 5:30 to 6 p.m. Fridays, Live Radio Ibadan and Sweet FM Abeokuta, 4 to 4:30 p.m. Spark 2.2 is supported by the International Budget Partnership, IBP.
Great to have you tuned to the network service of Radio Nigeria. The program is Spark. Spark is a program brought to you by the International Center for Investigative Reporting, supported by the International Budget Partnership, IBP, to tackle pressing issues in our nation around unequal maternal health care services, gender-inclusive agricultural support for small-scale women farmers, access to loans, among others. I'm your host, Blessing Ebireri. Today we're diving deep into a game changer for our healthcare, the Basic Healthcare Provision Fund, or BHCPF, launched under the National Health Act 2014. BHCPF aims to provide free basic health care to vulnerable Nigerians, think pregnant women, kids under 5, and the poor. But has it delivered? We'll examine its impacts and challenges. Joining me now to share expertise on examining the impacts and challenges of the BHCPF, Dr. Kelechi Ohiri, the Director General, National Health Insurance Authority, and Eze Uyekbiri, the Lead Director, Center for Social Justice. You're welcome to the program.
A pleasure. Thank you.
And to you, our esteemed listener, telephone lines for you to make your contributions are 0915 091 0482 or 0915 091 0483. You can send your questions on WhatsApp to 0810 250 7579. I'll take that again, 0810 250 7579. We are also live on Facebook at the ICIR. Don't forget to include your name and location. So let's dive into what we have for today. I'll be starting with you, Dr. Kelechi. Since the implementation of the BHCPF, what noticeable impact have you seen in primary healthcare delivery at community level?
Well, thank you very much, and good afternoon or evening, and thank you for having me. And I think you started by mentioning that it has been a game changer. Mm-hmm. I think this was the BHCPF was one of the critical interventions in the National Health Act of 2014. In the past 2 years, since this administration came in, we have seen a lot of impact from the BHCPF.
Okay.
Well, first of all, what does the BHCPF really cover? Mm-hmm. About 45% of it goes to primary health care, and this has expanded the number of primary health care facilities. Money goes in there every quarter for upgrades through something called decentralized financing facilities. It basically means money goes to the primary health care centers so that they can get commodities and supplies, do some basic upgrades, and also compensate staff. And this has led to an increase in utilization of those services compared to the non-BHCPF facilities. So with improved quality of care, more people utilize services. There's also another gateway called the Health Insurance Gateway, which is where my agency is involved in. And what we have seen is that at the moment about 2.4 million Nigerians are covered by BHCPF, working through state health insurance schemes. Right now, over all 36 plus 1 states have state health insurance schemes. So it's a collaborative effort between the federal and the states. In addition, what we have done recently is to take a look at the benefit package, what is actually being covered. And this is consistent with the law that asks us to set a minimum benefit package for Nigerians. And so that is in place. And it covers a lot of the conditions you mentioned, maternal, newborn, and child health conditions. And we have seen an increase in the number of beneficiaries. There are also other two gateways, one on emergency transport and one on the NCDC. Now, but I think one of the most critical aspects of BHCPF has been the governance. There's a ministerial oversight committee that meets quarterly. So every quarter we give accounts of what we have done. And it's the oversight committee is quite broad. It involves both all aspects of the health sector, including civil society, the media, and development partners. And then based on that, approvals are now given for the next sort of tranche. So monies are disbursed quarterly through the different gateways.
Okay.
So, but I mean, a lot of progress has been made, but a lot more can and must be done. And I'm sure we'll have a chance to speak to what plans we have to strengthen and improve upon what we have so far in BHCPF. Thank you.
Okay, thank you for enlightening us on that. Mr. Eze, can you tell us the major challenges or main challenges facing the effective implementation of PHCPF?
If Nigerians can remember, this is about 10 years since the National Health Act came into force. And having implemented the law for 10 years is a very good opportunity and timing for us to review and learn lessons of implementation so that we can make progress. The law talked about a minimum of 1% of the consolidated revenue fund. It just said the minimum, it didn't say the maximum. But what we have been doing so far is about a minimum of that minimum, that's the 1%. And then states were expected to put in some counterpart funding, to be able to draw on this money, but currently with the available information, states are not doing that. Okay, so the little money available is like a drop in the ocean if you consider the critical challenges we have in our health indicators, whether it's in maternal and child health or whether it's stunting, and then the quantum of services that is required in diverse communities across the country. So just this little drop, it is time to improve that, and that's why in civil society people are saying, why don't we make it up to 2 or 3%? Even there's a bill in the National Assembly clamoring for that, and some other people, some of us are saying no, this shouldn't even be about the federal government, because what states are behaving like free riders. This should be drawn from the federation account, whether it's 1 or 2%, which should be bigger, so that states cannot simply be spending federal government money without putting down their own. So there are quite a number of challenges in terms of the volume of the resources, and of course until recently there are clear challenges about transparency and accountability. Whether these monies are actually getting down to the very people that need the money. So in essence, and also the quality of the services that are being rendered at the various state levels. So in essence, this is a good time for review, or is a good start, but much more needs to be done, because we are discussing the implementation of Nigeria's minimum core obligation on the right to health. Okay, we are not even thinking of the big picture. We are just thinking of maybe basic healthcare services, as the name implies, and we are here to scratch the surface. A good start, but more can be achieved if we all get dedicated and then review that implementation properly with recommendations for the future.
So how are these challenges affecting service delivery?
Oh, definitely. If you have, let's say, 1 million people to attend to, and the resources you have can only attend to, say, 100,000, so you still have 900,000 people that are not being attended to. If the resources that are supposed to get down somewhere gets caught up in the middle and doesn't get to the grassroots, so there's also a challenge with that. And if the services being delivered are not exactly the quality that is being anticipated, it will still resonate on the people who need and demand these services. So that's a critical challenge we see there.
Okay, thank you for that. Dr. Kelechi, how well do community members, especially vulnerable groups, understand their rights and benefits under the PHCPF?
Thanks for that. I think it's important to situate this in the framework of overall health sector reforms in Nigeria, because the BHCPF as a funding source builds on a system. One of the things that Mr. President set out as a vision was for Nigeria to achieve universal healthcare coverage. And so many nations understand that to get there, there's a process of progressive realization. Some nations have done it by having very limited benefit package and expanding that to the whole population and gradually increasing. Some do it in different ways. In Nigeria, what we've decided to do is, as we expand health insurance coverage, for instance, or access to care, that we are very intentional about the poor and the vulnerable and making sure that they are part of it. And that's why there are several programs the government has undertaken to complement this. The BHCPF in the NHIA Act of 2022 places it as one of the sources of funds for something called the Vulnerable Group Fund. And it does define who these poor and vulnerable are, including poor women or pregnant women who have complications, are at a risk of dying, entirely displaced persons, etc. And in this regard, it complements a lot of things that are done for the poor and vulnerable, such as the financing access to emergency obstetric care that we have in the country, where every pregnant woman who has a complication in pregnancy or during childbirth and requires emergency obstetric care, it will be provided free of charge, and the NHIA would pay for that service. And this is, and in addition, the person gets insured through the basic healthcare provision fund, so that beyond the childbirth, there's also coverage for other things that may ail the person. So that's one. It's also important that one of the other ways is ensuring that for accountability, it is linked to NIN, so that somebody cannot be covered without them knowing, and it's a form of identity inclusion for the poorest and the vulnerable, and that was approved in the revised guidelines for BHCPF. And on quality of care, a lot of effort has been made in addition to the funds. The NHIA that accredits primary healthcare centers, for instance, has started working together with the NPHCDA to unify quality standards across primary care centers. And even right now, we've started a re-accreditation of all PHCs to see the ones that are fit for purpose and the ones that are not. And of course, the health sector has a broader challenge with a lot of brain drain and health workers emigrating. So there are challenges, but these challenges are being taken on head-on in the country to make sure that this gets to beneficiaries. Within the NHI, what have we done to get people to understand their rights? Well, first of all, one of the things that we introduced was the Enrollee Charter, which is a QR code that tells you what your rights are. And we have started the dissemination. We've had town halls and all over the country, but more importantly, this needs to be further, there should be more awareness, because empowering the enrollee is a critical part of improving services. We've also codified in a QR code all the benefit package that people get, so that you know what services are covered. And when you get to a clinic and you're told this is covered or this is not covered, you can just scan that and see what is covered.
What is covered, okay.
Exactly. So those are some of the things that we're trying to do to empower the enrollee and the person, so that they can actually demand better quality services, amongst many things. But for time's sake, I'll pause here.
Okay, you're tuned to the network service of Radio Nigeria, and the program is Spark, supported by the International Budget Partnership. We have been discussing the impact and challenges of the BHCPF. We'll go on a short break now, and when we return, we'll be taking your calls for questions and contributions. Please stay tuned.
To tackle pressing issues in our nation, such as unequal maternal healthcare services, gender-inclusive agricultural support for small-scale women farmers, access to loans, and much more, the International Center for Investigative Reporting presents Spark 2.2, a 30-minute radio program aimed at igniting discussions on these challenges and preferring solutions to them. Spark 2.2 airs every weekday on different radio stations across Nigeria. Mondays, Federal Radio Corporation of Nigeria, 5 to 5:30 p.m. Tuesdays, Anambra Broadcasting Services, 4 to 4:30 p.m. Wednesdays, Freedom FM Kano and Jigawa, 4 to 4:30 p.m. Thursdays, Prestige FM Mina, 5:30 to 6 p.m. Fridays, Live Radio Ibadan and Sweet FM Abeokuta, 4 to 4:30 p.m. Spark 2.2 is supported by the International Budget Partnership, IBP.
We have been looking at examining the impact and challenges of the BHCPF. The telephone lines are open for you to make your contribution or ask question. The numbers to call are 0915 091 0483 or 0915 091 0482. Mr. Eze, I'll be coming to you now. In your view, what are the effects of corruption on the BHCPF funds?
Well, that would be assuming so much that maybe there's a lot of corruption, but let's try to, I want to react a little bit to some of the issues raised by the DG, because even before now there has always been a Patients' Bill of Rights, okay, which encompass quite a lot of things. But the greatest challenge I see is that a lot of good ideas are hanging at the top. Okay, like we're in Abuja, we're in Lagos, we meet at summits and conferences and talk. But the primary healthcare center in my own village, in fact, that's the place where I was born so many years ago. I know what it looks like. And I also know I participated in a meeting in the last couple of weeks. A unified portal, whether it's at the MPCD or at NHIA, where once you release money, citizens can simply type in and go there and find out what exactly has been released. Yes, we know the amount of money in every community. Every one of those communities, you see those PSCs there. So you can now say, stay in Abuja if you have the contacts and ask people in your villages the question so that you get a proper feedback. So there is still some form of not too transparent process. So once transparency...
So can you hold that thought? We have a caller. Hello, good evening. What's your name and where are you calling us from?
Good evening. Thank you for this great program. My name is Gracious. I'm calling from Gangaladan.
Thank you, Gracious. What's your question?
Okay, so I want to know, in this case, what are the key challenges that have been hindering the effectiveness of BHCPF to be able to run with most of their key implementations? Because it looks like that's like a major concern. Yes.
Okay. Thank you, Gracious, for your question.
Thank you.
You heard what Gracious says.
Yes, I heard her, but if she had been listening, the discussion.
We talked about
that's what we are discussing. So I was saying that the most effective way to increase transparency and thereby maybe reduce corruption is openness.
Okay.
Publish whatever is paid to each of those PACs and whatever the various agencies.
That we have another caller. Hello, good evening.
Good evening. Yeah, I'm Joy calling from Abuja.
Thank you, Joy. What's your question, please?
What are the basic guidelines for accessing care under the Basic Health Care Provision Fund?
Basic guidelines. Okay. Thank you so much, Joy.
You're welcome. Thank you.
Did you get that question? The basic guidelines for accessing care under BHCPF. We'll come to that after Mr. Eze. Continue, please.
So just like I was saying, if we can have more transparency to help more Nigerians to be able to ask questions, and once people are asking questions, those who are delivering may likely sit on their toes and may likely begin to listen more and work more effectively when there is that concrete demand. But because that concrete demand has not arisen because of that lack of information and access to information, so that's a critical challenge I won't see solved in the next couple of, maybe by next quarter of 2026, it could possibly be done.
Okay, thank you so much for that. Dr. Kelechi, do you want to respond to the caller's question? You're talking about basic guidelines in accessing.
Yes, I think there are two elements of basic healthcare provision for primary care. One is, there are the healthcare centers that have been a part of the program, and MPHCDA's website has a list of all those facilities and notifies their beneficiaries to that program. And to the question about accountability, I think, yes, it can always be improved upon, but I think steps have been taken in that direction. First, the fact that there's an oversight committee that interrogates quarterly performance across all the major gateways is a step in the direction. That's an open meeting that has civil society, media, development partners, the state, and all stakeholders represented. And if you recall, recently the Ministry of Health issued a red letter also as a call to action to have people actually interrogate their local primary healthcare centers. You're getting money from government, and what is the accountability? What are you doing with it? And of course, more can be done, as was mentioned. We can go a step further and even make it more transparent what actual amounts are being transferred. But the main thing is, let people have the right expectations and demand, those services of the providers. We sit in Abuja. We work with the state governments and the state agencies, and now with the local governments as well. They're also represented in the governance. And I think it's one of those things where collectively we all have roles to play in this. And I see the BHCPF primarily as being catalytic in support of what states and local governments are primarily mandated to do, which is provision of primary health care. And this is the federal government's commitment to catalyze that as part of the BHCPF. In terms of the demand side, if you are enrolled, the guidelines are that you will have like a primary healthcare center that is sort of your primary care provider. But if you need care, secondary level care, then you are referred to the secondary care provider or the tertiary care provider, depending on whether the illness is covered in the benefit package. What we had seen historically was low utilization, probably because one, the facilities themselves were not in a state to provide good quality, hence the direct facility finance and the upgrades that we have started undertaking. A second, because people perhaps are not aware of their rights and not aware of what to expect, and we have to do a lot more. And one of the things that we landed on was the role of civil society and the media in creating awareness. I think programs such as this and others to make sure that people know, this is the primary health care, this is what to expect. In my village, the PHC was one that was, refurbished before I came into my role, but I always kept asking through my local village, so what's going on there? And also advise that they also hold them accountable, so that services are being provided. Like I said earlier on, it's a journey that we're on, and the Community Minister for Health and Social Welfare, and through the Health Sector Renewal Investment Initiative, has laid out that roadmap for what we want to do to improve access, and I believe very strongly that the trajectory we're on will get us, closer there. And the last point on the guidelines, one of the things that was approved at the last MOC meeting was the revised operational guidelines for BHCPF. I don't have enough time to go into details, but issues around operations, issues around fiduciary management, and issues around the program were revised across all the gateways to make it more efficient and to ensure that there was more accountability. And maybe if there's time, I might give some examples.
We really don't have time.
Thanks.
Yes, I think a critical challenge we have is that a good number of Nigerians are not really convinced that some of the people whose name appear on that register of the poorest of the poor are really poor. And so we need to get to a stage where that register should be audited and vetted to be sure that only people who are qualified, who are poor, are on that list, and not people who, due to their political connections at the local government or grassroots level, or being the real poorest of the poor, are not in any way benefiting. So that's a critical challenge thing we need to get up to and solve it, so that this little money benefits the actual demography should benefit.
Okay, so Mr. Eze, what role should community health workers play in extending BHCPF to insecurity in northern states facing insecurity?
Oh, this is a very troubling question. I'm not a security expert.
Yeah, but
you need to know this.
Yes.
And somebody has to be sure of his life before he begins to take care of the lives of others.
Yes.
So if I have a brother or sister who is going into those places, I may not get my support. So first of all, let the government create that security so that people can go to save lives. And the part of the critical challenge we have is that we don't have the requisite human resources in this primary healthcare center. Some of them, from what I've seen in some areas, don't even have qualified nurses or qualified midwives attending there. Doctors don't come there. You have only choose no qualified nurse or midwife. So what kind of service exactly are you rendering? And at the level where even if I were to be poor today, I will not think I can't subject myself to that kind of service, and I may not likely recommend it to any person who is my brother or sister who is close to me, because that's not really a service. That's not really a medical service properly so called.
Okay. Dr. Kelechi, on a scale of 1 to 10, can you rate BHCPF's impact on reducing maternal health?
So I think let me first...
As we round off. Yes.
I think first, let me just point to clarify a few things.
Okay.
On the issue of the register, I think what's being referred to is the National Social Register, whether people are convinced by who is in it.
Okay.
One of the reforms in BHCPF is to make sure that every beneficiary is enrolled into NIN and with NIMC. NHI has an MOU with NIMC.
Okay.
And we've started, and the minister has given everybody till December 31st to make sure every enrollee has an NIN, so you can verify these persons. Apart from the self-selection, that these are public primary care centers which are intrinsically pro-poor in terms of those who actually benefit from them. And then on the health workers, we have a health worker shortage, but Nigerian CHUs are trained. And through the process policy of task sharing, there are basic primary care services that can be provided by them. Of course, complemented where are they available by midwives and others. And I think more can be done. And I think it's important to also acknowledge what has been done and the steps we're undertaking. I think finally, in terms of where we are, I mean, I think there is progress that has been made. The challenge is quite a lot, but I believe that directionally we're on the right path, and we'll continue to move to make sure that Nigerians have access to basic primary care and where needed referral care by attacking both the supply side interventions as well as from the NHI's perspective, demand side interventions.
Thank you very much for joining us on today's program, Dr. Kelechi and Mr. Eze. I hope when we call you next time, you oblige us. Many thanks to the studio manager, Mahmoud Abdullahi, the producer, Vivian Onowawari, the engineer, Wanwe Oyebuchi, ICT, Jonathan Aina, and the ICIR social media team led today by Israel Shushemi and Gobri Abdulaziz. I'm Blessing Ebiri. Stay tuned for the next program.
To tackle pressing issues in our nation, such as unequal maternal health care services, gender-inclusive agricultural support for small-scale women farmers, access to loans, and much more, the International Center for Investigative Reporting presents Spark 2.2, a 30-minute radio program aimed at igniting discussions on these challenges and preferring solutions to them. Spark 2.2 airs every weekday on different radio stations across Nigeria. Mondays, Federal Radio Corporation of Nigeria, 5 to 5:30 p.m. Tuesdays, Anambra Broadcasting Services, 4 to 4:30 p.m. Wednesdays, Freedom FM Kano and Jigawa, 4 to 4:30 p.m. Thursdays, Prestige FM Mina, 5:30 to 6 p.m. Fridays, Live Radio Ibadan and Sweet FM Abeokuta, 4 to 4:30 p.m. Spark 2.2 is supported by the International Budget Partnership, IBP.